group includes all Georgians 55 and older, as well as those 16 years and older with high-risk medical conditions. So those include asthma, cancer, diabetes, heart conditions, cystic fibrosis, and sickle cell disease. The expansion coming at a critical time, with the CDC ranking Georgia as the worst state in the country when it comes to getting first doses to residents. 11 Alive's Brittany Klein-Peter is live outside of the state capitol after speaking with the governor. And Brittany, the governor is hoping to expand eligibility even more very soon.
That's correct. This afternoon, the governor said he hopes by next month that he'll be able to give the vaccine to all adults. But public health experts are saying that Georgia's approach so far has put them far behind other states that are already offering the vaccine to more groups of people.
We don't want to create such demand that we have, the horror stories that we saw in other states of long lines, but we also don't want to have supply sitting out there with not having the demand for that supply.
The lines we did see today, educators eager to roll up their sleeve and get their vaccine. They just became eligible this week, and in Henry County, school staff were in and out at this McDonough site all day.
I got teary-eyed a little while ago, just waiting. I am so excited.
While the governor, Kemp, says the state is making strides in its fight against COVID-19, the CDC says Georgia still has one of the lowest vaccination rates in the country. According to the latest data from the CDC, the majority of states have already given out at least 86% of their first doses. Georgia is faring the worst, sitting below 70%.
I think that a big challenge that Georgia is facing is making sure that they're matching up dose supply to where it's needed.
Public health expert Amber Schmidt blames poor matching for the state's lag in vaccination efforts, but says expanding eligibility to essential workers, targeting remote areas with mobile vaccine efforts where transportation is limited, and monitoring vaccine appointment availability could speed things up.
Because these are the numbers we have, I think it's fair for us to be skeptical or critical of what's going on, because this is a life-saving tool and people are dying.
Governor Kemp says that the state is working to move vaccines where the demand is greater by using data from its GMA mass vaccine sites, as well as working to promote the Johnson & Johnson vaccine. With Georgia expanding eligibility next week, Governor Kemp says that he will now be able to get a vaccine, and he's eager to show people how safe and effective it is.